questions being put. Would those members who wish to speak in the debate please press the request to speak buttons, and I call on Stuart McMillan to open the debate for around 7 minutes, please.
Thank you very much, Presiding Officer. Presiding Officer, I'm delighted to be leading this debate, and I'm grateful to all the members who have signed the motion and also those who are going to speak this afternoon. I'd also like to thank all the organisations who provided briefings for today's debate. Ahead of today, I hosted an RNIB Scotland stall in the Parliament last week, and I appreciate the time that members gave to visit the stall. The team staffing the stall were delighted at the number of MSPs who visited and also to learn about eye health and also the services that RNIB Scotland actually offer, and also many and varied conditions that exist. Thank you very much, everyone. Since 2011, I've chaired the cross-party group on visual impairment, and prior to this, I was a member of the CPG when I was first elected in 2007. Which is why I'm always keen to raise awareness of Eye Health Week, as I recognise how important it actually is that we continue to highlight the importance of eye health, the progress that actually has been made in this area, but also the challenges that still exist. And to begin the speech, I'd like to celebrate the success of the free eye test policy in Scotland, which, since 2007, has been backed by £775 million of funding, following its introduction by the previous Labour Liberal Democrat executive in 2006. In the initiative's first year, 1,349,979 people obtained free eye tests, and in the last full year, that's 2017-18, that figure rose to almost 2 million people. And I'm quite sure that ministers pre-2007 would have been delighted with the growth in people obtaining the free eye tests, and I'm sure that every health minister since 2007 will be delighted with the continued annual increase. And overall, more than 21 million tests have been conducted since the policy came into effect. While the national average uptake of sight tests across all health boards sits just below 1 in 3 people at 31.8%, I'm pleased that my own health board area, NHS Greater Glasgow and Clyde, is actually bucking the trend with 33.1% uptake, as compared to the lowest at NHS Orkney at 24.1%. which emphasises that more work still needs to be done to encourage everyone in Scotland to actually access the free eye health checks. The sight loss, like many conditions, can affect anyone, which is why it's important to realise that eye tests don't just actually go and test your sight, but they also detect symptoms of other serious health conditions such as diabetes, high blood pressure, stroke and cancer. And if an eye health check can identify changes in the eyes before they affect the vision, then the condition can be treated before it reaches an advanced stage. This is in patients' and also our NHS's best interests, as it's cost-effective and also more efficient in meeting the medical and the social costs of people who may otherwise go on to lose vision or suffer ill health unnecessarily. Now, every survey shows that sight is the sense that people fear losing the most, yet we can be surprisingly negligent about our eye health. We tend to think of our eyes as only being for people who need to go and get their contact lenses or glasses. But the reality is that we should all get our eyes checked regularly, but actually every 2 years, so to keep healthy. Now, last year, alongside Kate Vallis from RNIB Scotland, we had a stall outside of Specsavers in Oak Mall in Greenock to make shoppers aware of the free eye test. It certainly was a hard shift. Certainly I've had easier shifts distributing political material, I'm not going to lie, but I accept it may actually have been the fact there was a politician there trying to give something out, but certainly it's an issue that had actually been raised before in the cross-party group, but also I've had with discussions with others. At the cross-party group meeting in May, we had a presentation by Dr. Alexandros Zangalidis from the University of Aberdeen, and his talk that night was titled "Eye Care Services in Scotland. Did the Scots Get It Right?" Where he discussed his research regarding the introduction of the free eye examination in Scotland. His analysis concluded that overall the policy has been a success and it is to be welcomed. However, he also highlighted some challenges facing communities, like mine, with areas of poverty and deprivation when it comes to looking after our eyes. Although more people are getting their eyes tested, there is now a small but a growing gap between the less well-off and the more affluent in society. There were various theories as to why those from the SIMD areas are less inclined than others to actually go and get their eyes tested. Now, one theory was that if an eye test indicated they needed glasses that they couldn't afford them, then this then leads to the gap, even though and I must stress this, people actually are going to get their eyes tested, but it can lead to the gap potentially increasing. Now, Dr. Zangaleris' research also mentioned the people's lack of understanding around eye health, which could explain the hardship that Kate and myself actually faced last year when trying to make people aware of the free eye tests. So how do we fix this? I would like the Scottish Government to consider a few actions. Firstly, a refreshed public information campaign, making people aware of the free eye examination. And secondly, a targeted approach towards communities with economic challenges. And I would be quite content for parts of my Greenock and Inverclyde constituency to be used in any such pilot scheme. Presiding Officer, 4 of the most common causes of sight loss are age-related macular degeneration, cataracts, glaucoma, and also diabetic retinopathy. That's now the single biggest cause of sight loss among Scots of working age. Now, I've had constituents living with these conditions, which is why I visited the Jenny's Well facility in Paisley earlier on this year. It's one of Scotland's only 2 specialist residential care homes for visually impaired people, older people, which is run by Royal Blind. And also, I went across the road to the Scottish War Blinded's Hawkhead Centre, which provides free support to ex-service personnel living with sight loss. Well, some of my constituents actually use these services. There are still many more who could benefit, which is why I'm keen to highlight these facilities at every single opportunity. However, it's not just older people or veterans that are affected by visual impairment. As the Scottish Government's school census figures indicate, the numbers of pupils with visual impairment has more than doubled since 2010. When you consider that in Scotland over 180,000 people live with sight loss, and this figure is expected to double over the next 20 years, and 50% of sight loss is preventable, then it's evident that free eye health checks are an important measure to help keeping our nation healthy, and it's also one that can make a real difference to people's lives. In the briefing, Optometry Scotland highlighted the General Ophthalmic Services, the GOS Scotland Regulations 2006, which has revolutionised the delivery of community eye care in Scotland, most notably leading to the shift in the balance of care away from GPs and hospitals, freeing up vital resources. In 2016-17, Optometry Services indicate that it saved the NHS £71 million, with community optometry stopping over 370,000 people from attending hospital for eye issues every year. Additionally, over 80% of acute eye conditions are now managed by optometrists. That's up from 25% prior to the GOS's introduction 12 years ago. Now, while Scottish Optometry is leading the world in design and delivery of community eye care, Optometry Scotland state that a concerted focus on forward planning for an increasing older population is needed, along with the Scottish Government-supported strategy to encourage people to consider a career into the optical sector. In Scotland today, the number of registered blind and partially sighted people is around 34,500 people. And every 7 minutes, somebody in the UK will be diagnosed with macular disease, which is the biggest cause of blindness in the UK. In conclusion, Presiding Officer, it's pertinent then that we as MSPs do all that we can to make our constituents aware of the free eye test in Scotland, so that the numbers of people benefiting from this policy increases, which should mean preventable sight loss decreases, and as many people as possible can live life seeing the full picture. Thank you very much.